My guest today is Dr. Laurie McCauley. Dr. Laurie McCauley is a trailblazer in veterinary rehabilitation with a passion for helping pets move better, feel better, and live longer. After graduating from Colorado State University's School of Veterinary Medicine, she opened the first veterinary rehab clinic in the United States and designed the very first underwater treadmill for dogs. Super cool lady. She saw what was possible before the profession even had a name for it. She's board certified in canine sports medicine and rehabilitation, certified in acupuncture and chiropractic care, and spent 14 years teaching at the Canine Rehabilitation Institute. Through national conferences, international lectures, and her signature online platform, Optimum Pet Vitality, Dr. Laurie has inspired thousands of professionals and just as many pet parents to rethink what's possible when movement becomes medicine. She's also a published author, award-winning educator, and the creative force behind a new wave of integrative, mobility-focused care, bringing hope, healing, and joyful motion back to dogs around the world. I'm super excited to have Dr. Laurie on today. She's a cool cat, very educated, but well-spoken, easy to understand and comprehend. So without further ado, let's hop into today's episode.
Good times.
Hey everybody, and welcome back to another episode of the Pupping Away podcast. My name is Steph. You may know me as Steph the Pro Dog Mom on my social media. I am a certified dog trainer, a canine behaviorist, canine nutritionist, and the very proud owner of Pupping Away in San Antonio, Texas, where we specialize in pet care with a behavioral edge. That is things from boarding, socialization, training, all that kind of fun stuff. I am joined today by Dr. Laurie McCauley. Did I say that right? McCauley.
Yeah.
Okay, perfect. I usually call you Dr. Laurie. So, Dr. Laurie McCauley, I met you for the first time and got introduced to your work in the first time, excuse me, at the Federal Institute, the Federal Summit that we just had in October. And I learned a lot of stuff just by visiting your booth. You're so down to earth, such an amazing person. And then when I found out all of the really badass things that you've done, I was like, I was talking to her. Wow, it was so cool. So first and foremost, thank you so much for joining me today, and thank you for everything that you do. So for the listeners, kind of just introduce yourself and what makes you so cool.
Oh, well, I don't know if I'm cool. I'm definitely a nerd. I'm Dr. Laurie McCauley. I started the first rehab clinic, designed the first underwater treadmill. I've taught internationally. I love it. In fact, I just got asked to speak in Lima, Peru in 2027. Yeah, for the South American Veterinary Medical Association, which is like super cool.
That's awesome. Congrats.
Yeah, thanks. I love teaching. I'm one of less than 130 veterinarians in the world who are board certified in sports medicine and rehabilitation.
Whoa.
Certified in acupuncture, chiropractic. I do some osteopathy and a million other things. I have 2 feet, one in the nerd science world and one in the energetics world. And my mission in life is empowering people, optimizing pets. So basically, how much can I teach people so they can help pets?
I love that. Yes, your platform is amazing. We'll talk about that in just a little bit, but you definitely have a background as a vet, right? You're a DVM. What kind of took you from quote unquote regular conventional vet and made you think about there needs to be more stuff done for rehab and to kind of, pioneer some of those things in the canine rehab and sports medicine realm?
So there was no other world, right? It was just regular medicine. And I had been out for 6 years. And to be 100% honest, I was bored, right? And there were so many of my patients that I couldn't fix. And every time I'd see, I'm one of those people who every journal I got and I read cover to cover because I wanted to know everything I possibly could. And every time I go, oh, there's a pain article. Oh, it's another drug. Oh, there's a pain article. Oh, it's another drug. And I'm like, there's got to be more. I got to be able to help these guys. And then I fell down the stairs, putting my dogs out at 3 o'clock in the morning and hurt my back. And my chiropractor couldn't fix me. He sent me to an orthopedic guy who sent me to a physical therapist. And I went, oh, this is so cool. And at the same time, I had in my heart that I needed to learn acupuncture. And I was at what we called the Cadillac Clinic. So we had like I mean, this was 96, 97, 98, and we had color flow Doppler ultrasound. We had the first laser surgery unit in all of the Chicago, Milwaukee area. And I went to my boss and I said, I want to learn acupuncture. And he said, I don't believe in it. I won't give you the time off. I won't pay for it. And if you do it, I won't refer to you. So a very clear line in the sand.
Yeah.
And I said, I have to follow my heart. And at the same time, my sister-in-law said, so I said, I'm going to learn acupuncture. My sister-in-law said, she trains police dogs, right? They had like 100 police dogs that they were working with. And she's like, if you're learning acupuncture, see if you can learn some physical therapy, because we have all these dogs that get injured, the police dogs. The surgeon says they're fine, the x-rays say they're fine, but they don't function the same way. I'm like, oh, we'll just take another class. Okay, there was no class. So I was very blessed. I don't know if if you're old enough to remember emergency vets.
Yeah.
Yeah, okay. So I was in a couple episodes
Oh, that's so
because
cool.
I called Rob Taylor and I said, hey, you had a physical therapist that was helping teach at Bel Ray, which was a tech school associated with the hospital. I said, can I come and just work a month with you? And he said, I never let people do that, but for some reason I will. And I went and I read every physical therapy textbook I could read. We did some research together, and I came back and I opened up TOPS, standing for, for my sister-in-law's business, so it's Tracking, Obedience, Protection, and Service.
Okay.
And then we had TOPS Veterinary Rehab. And what I thought was going to be, I had a 6-month-old son, a 3-day a
Wow.
week, 6-hour a day, boom, exploded. And I was working 60 to 80 hours a week, every week within like 6 months.
Wow.
As it works. And think about it. What started in 98, there's now a board certification for, right?
Wow.
And I've been board certified for over a decade. So, I mean, that's just amazing how cool it is and what we can do with dogs.
And that you were there from the very beginning. That is super
Yeah.
awesome. I feel like your brain should be like this big. Like your head should be so much bigger because you have so much knowledge in there. It's just super awesome. You also designed the first underwater treadmill, which is super cool. I've seen those. There's a vet clinic here in San Antonio that does it. A couple of my clients go and see them for some rehab. And when I found out that you were the one who designed that and pioneered that and put it all together, I was like I don't know. That's just super cool. What made you think that we need that for dogs?
Well, because we didn't have what I was looking for. And so I reached out besides the dog world, and I found that they had created them for horses first, because horses would get injured, they'd be stall rested, and then they'd go out and they'd get, or they'd have surgery and they would be stall rested, and then they would never function again well, right, competitively. So then they started swimming horses, and they thought that was great. They kept the muscle strong, but without pressure on the bones got weak. And then they would do really well for 3 or 4 races and then break a leg and have to be euthanized. So they came up with the underwater treadmill so that there's still pressure, so the bones stay strong as the muscles stay strong, but their weight is lifted anywhere from 10 to 90% off of the joint. And then they started doing it with humans, and now they actually sell a lot more underwater treadmills for dogs than they do for humans or horses.
Oh wow.
So yeah, so we literally, there was nothing, there was no tanks. So I contacted a pool company, and inside we put 10-inch thick walls. And then I called the Brookfield Zoo and got the same glass that they use for the polar bears.
Wow.
And then we took a home security camera and put it on the outside of the glass, and got this was like before this was even popular, a computer monitor, and attached it to the ceiling, so that while we were working with the dogs, we could see exactly what they were doing and be able to help move their feet or stimulate their tail or whatever. And it was on a boat lift. Actually, the first one was on a jet ski lift. And I learned that if you do this a lot, you get tendonitis in your elbow. So when we built our new clinic, we put in a boat lift that would hold 3,000 pounds. So we could just push a button and it would go. And we put
Nice.
jets in there so we could have added resistance. So yeah, I wanted everything I could do to help the dogs.
That's super cool. And it just came out from needing something, not finding it, and you're like, well, okay, let's do it. Let's put it together.
Yep,
I
yep.
love
I'm
that.
definitely an out of the box thinker.
You gotta be sometimes, right? I love that.
Yeah.
So you now run Optimum Pet Vitality, which is more of an education platform. You still have do you still have your rehab? Oh, you do mobile rehab
Now
now.
I do, yeah, I do red tail rehab, yeah. And you
Good to
won't
read.
find that online. That's totally under the radar.
I could tell. I was like, I can't find more information about this. But you have your education platform, which is a wealth of information for anyone who's interested in learning anything else or any more about anything that we talk about today. And you said that you love to educate people, and that's very obvious. You teach courses like you have Core and More, and then you also have Fascia One-on-One, which you call the Forgotten Organ. Why I think we tend to forget that our dogs like have a body that operates just like ours. They can get sore, they need to stretch, different things like that, that they have a core that needs to be strengthened also. Why are things like core strength and the fascia just like really important for our dogs' comfort, and then even I think even more so for our dogs who are performance dogs?
So you mentioned Cord. Can I tell you that story?
Yeah, please.
So Sid, my little man back here, came to me at 11 months old, and I adore him. He is like my heart dog. And I said, you have straight knees, straight shoulders, and a long back. And I am a rehab mama, and you are not going to have a cruciate injury. You're not going to have a shoulder injury. You're not going to have an iliopsoas or a back injury. And I put together an exercise program for him, and I was doing well, and I sent it out to some of my friends. I'm like, hey, what do you think of this? And they were like, oh my God, Laurie, this is amazing. In fact, one of my dear friends still in Chicago started her 9-year-old agility dog on it, Sophia, and she's like, I had no idea. She works for dogs. She has 5 shelters. She works for dogs all the time. She said, I had no idea what her potential was. And at age 11, she was the 7th fastest agility sheltie in Bad Dog Agility. And all
Whoa.
the other 10, because they list the top 10, were like 4, 5, and 6 years old.
Wow.
So yeah,
She had a
so
six pack.
yeah, oh, absolutely, right? And it's these exercises were designed to strengthen muscle, tendon, ligament, fascia to decrease injury and allow dogs to have the best health span and lifespan possible for their whole life. And then you asked about fascia. So well, again, one of my favorite topics, right? Fascia, again, I'm a nerd, so forgive me if I go into scientific speak.
Please do.
Okay, so fascia is actually responsible for 40% of the power of the muscle. Okay, so when you use a muscle, you think, okay, I'm using my biceps, and 40% of that motion, of that pull, is from your fascia.
Okay.
And you can build fascia for strength. So like there was a study done looking at a Olympic javelin thrower. And they used an ultrasound to look at the fascia across his bicep muscle, his tendon. And on his non-throwing arm, it was zero point 0.5 millimeters. And on his throwing arm, now he uses it a lot, it was 3 millimeters. So 6 times thicker, right? Think of all that protection around that joint and
Yeah.
around the muscle, right? So fascia is around every blood vessel, every nerve, every lymph vessel. So when it gets what we call sticky icky, right? So it gets full of sticky stuff. So metabolic waste, toxins, things like that. Fat infiltrates it. Um, Fluid can't flow. So fascia takes up the space around every cell. In fact, there's electron microscopy that shows that it goes and touches the nucleus of every cell in the body.
Wow.
So when it gets all tied up, not only can you not move, but you have less blood flow. You have the nerves are compressed, so you have more pain. You don't get your nerve function going as well. Uh, it's around the lymph, so disease happens more, right? Infections, swelling, all of that stuff. We can manipulate the fascia to get it healthy, so we can get the whole dog or cat or horse or frog, right? I actually used the tuning fork on my pet pigs the other night.
Whoa.
Yeah, so I mean, we can manipulate it to make the dog happier, healthier, and have a better life, and that's what I'm all about.
That's insane that not more people are talking about that. We hear joints, we hear muscles, but no one's talking about, and you say fascia, not fascia, fascia.
Well, tomato, tomato,
Tomato,
whatever.
tomato. It sounds more, it just sounds more elegant when you say fascia, so we're gonna go with that one. I love that. So obviously you work with a lot of dogs. I'm going to assume a lot of dogs who are recovering from things, obviously rehabbing things. But I'm also going to assume that you think that working the body and prepping the body is just as important, probably more important, like preventative care versus rehab.
Oh, absolutely. And just like, I don't know if you've ever heard of silver sneakers. That's doing exercise for people that are geriatric, so like
Ooh.
80, 90, right? They have shown that they can significantly increase their health if they start doing exercises, even if it's just, I'm in a chair, I'm going to get up and sit down, right?
Yeah.
Um, so exercise and taking care of the body is beneficial throughout the whole life. And it can be from puppies to prevent injuries, to adult dogs, to the athletes, to our geriatrics, to our post-injury and post-surgery. We can help all of them.
Yes, not new information for you, but not for the listeners. I talk about my dogs all the time, but I have two schnauzers. One of them is 16 years old. His name is Sully. So I have been like digesting, like just like tearing down your all your geriatric, your senior dog information because all that's really cool. Because I definitely see a difference with Sully. He started to muscle waste and kind of get a little bit skinny a couple years ago. We got his muscle back. He had some pancreatitis a couple of months ago, so lowering his fat content has definitely made him kind of recycle through that all over again. So I'm already seeing once again kind of more like back leg stiffness. He doesn't, he's a little bit more wobbly than he used to be. So I really appreciate all the content on your website because I've definitely been going with those videos and trying things out with him. I could do them more often. I'm really good about getting myself to the gym. I'm not very good about getting Sully to his gym. So I do need to put more emphasis on that.
Can I help you? Can I?
Please.
So the two most important exercises for any dog that you worry about them having trouble getting up or they slide out is
Yes.
exercising backwards and sideways. Because
Yes.
the
Okay.
backwards muscles are the muscles that help them go forward, and then sideways help them stabilize so they don't splay out and hurt their shoulders or their hips. And if you have a schnauzer, the best way, does he like peanut butter? And are there no?
Yeah, of course.
Okay.
He loves food.
He loves food. So if you take a wooden spoon, and actually I'll pretend my tuning fork is a wooden spoon. If you put peanut butter on the end of the spoon and then put a piece of wax paper under it and freeze it,
Okay.
then what you can do is make that an arm extender so that if you want him to go backwards or sideways, you can be holding that without having to lean over and hurt your back.
Good information. That's so funny that you say that because we use that trick a lot when we're teaching small dogs how to do loose leash walking. I didn't think to, again, apply the same information to other things because, yeah, sister's got some back issues as well. Me being sister.
Oh, okay. Can I give you another one?
Please.
So you have a schnauzer, right? Put him on your bed.
Oh, yeah.
Next to
Elevate.
it, and then you walk and have him go sideways. You can go lengthwise, foot around, and then go the other way. And
Okay.
again, it keeps your posture up and down, and they still have a treat in front of them. You're the wall so that they can't fall off, and you can walk them that way, and it's a lot easier on you.
I'm excited. Yeah, I read that as one of your, oh gosh, I think I submitted a form to get your, I think top 5 or top
Oh,
8
okay.
or something. And
Yeah.
those are the two that I was like, those, I need to do those more. So I'm really glad that you validated that I was feeling the right thing to do with him.
Yeah.
I gotta do more. It's important for the man.
So do it before he eats or with part of his dinner. Then
Okay.
it makes food time fun. And, right, they all love getting food. And this way he won't gain weight because he's just getting his food.
And it also puts me on a schedule. I think that's,
Yep.
it's me. I'm the most important part of like just stuff you just gotta do. You just gotta find the time to do it. I'm writing notes.
Good,
I love
good.
All right. You're the best. So when a dog first comes to you, I'm going to assume a couple of different categories that you look to because you do a lot of work, right? Not only in prevention, maintenance, and rehab. So what are some things that you're looking at kind of more first than others? Like if a dog comes to you that's in pain, what are you looking at? Where are you going to start, I guess?
So the first thing is we do a full exam. So we check literally from the toenails all the way up to the shoulder, up to the hip, down the back. We do a general exam. We do muscle girth to see if there's any atrophy. We do a neurological exam. We do gait, right, back and forth and across, so we can see any abnormalities. We do transitions, so from stand to sit to down to sit to stand.
Wow.
We do what we call cookie stretches, right? So that we see if there's any restrictions or pain in the spine. And then we put it all together. The way I look at it is everything we look for or at is a puzzle piece. And when we get done, we look at the whole dog. We put the puzzle together and then say, okay, here's our list of differentials. Here's our list of problems. What can we do that will give us, one, the most bang for the buck, and two, how much can I teach my client? And I always say this lovingly, so that they can do more, so they have to see me less. And that
Yeah.
means I'm free to take care of another dog.
I love that. Yeah,
Yep.
I think for me, I'm a dog trainer, right? And so what I found is when the client, the human, understands why we're doing certain things, number one, they start to see the progress be a lot faster. But number two, they tend to do it more because they see the
Right.
value in whatever it is that we're teaching. So I guess the same thing kind of goes for you as well.
Yeah, absolutely.
Are there some like big myths or like misconceptions maybe that you are just like, "Ah, I'm so tired of hearing that." Like for me, I'll give you one as a dog trainer. Oh, you must be like Caesar Milan. We don't like Caesar Milan.
Yeah, no, 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 no.
I'm not a Caesar Milan fan. So are there anything kind of like that, things that you're just like, man, I wish that people would understand that that's no longer valid maybe.
Yes, yes, definitely. And thank you for asking, right? So the first myth that drives me crazy is the cruciate disease starts at the rupture. No, I find cruciate disease months to years before the rupture. And
Okay.
once people understand what to look for, then they can change the progression so they don't get to the cruciate rupture. I have a patient who we found cruciate disease at 2,
Wow.
and at 8 she was in the finals for UKI agility. That was last
Wow.
year. Yeah, so I mean, and we got rid of the effusion because I taught the owner how to feel for it. We got rid of the crepitus and scar tissue, and she's able to function and do amazing. So that's a huge one. And I don't know if you know this, if you were an orthopedic surgeon, 50 to 80% of the surgeries that you do would be fixing cruciate ruptures.
Wow.
And I want to get that way down. And then once someone's dog has a cruciate rupture, then there's a 50% chance that they're going to tear the other one within 2 years.
Is that because of the overcompensation that they're doing at that point, or just
A lot of things. So
okay?
it's, is it breed, right? Is it how they are built, right? And simple things like diet make a difference. When they're spayed and neutered, make a difference. If they're overweight, it makes a difference, right? And then if they don't have rehab after the first one, what do? They don't put weight on it, so they're overusing the other one that probably already had inflammation and nobody is looking and nobody's treating, or they're doing rehab and they're just treating the first one instead of saying, hey, there's a problem here too.
Yeah.
And that the ligament, think about it like a rope, right, with lots and lots of strands. They just pop, 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 right?
Okay.
And we want to stop that from happening. So that's one. The next myth I have is that scar tissue and fascial restrictions are just there. No, they're not. We can definitely make them go away. Well, you saw me, right? So I was vending and working on people so they could see what the tuning fork felt like. I was at, what was it? I think it was the American Association of Veterinary Acupuncturists. And one of the ladies there came and said, hey, I've got, I was a competitive tennis player, and 20 years ago, my elbow was stuck like this, and in 20 years I got it to here. And then we used a tuning fork, and in 10 minutes maybe, we got it totally straight, right? We got rid of the scar tissue around her elbow, which meant that she can then use muscles, tendons, and ligaments so that she doesn't get arthritis and she doesn't have problems.
In just 10 minutes.
In just 10 minutes.
Wow.
Yes. This,
Yeah.
that's what the tuning fork stuff is so freaking cool.
It is.
The way I learned, right, because things happen to me always for a reason, about the lapis tip for the tuning fork is because Sid, my heart dog, we thought he ingested something, right? He just had all the signs of foreign body, and they went in surgically. He didn't have anything. They sewed him back up, and I had to travel. I was lecturing. So I was in and out of town for 2 weeks, and I came back, and his incision was infected and nasty, and he had scar tissue. And my dog, who can do, you know what sit up in bag is?
Like the sit pretty?
Yep, sit pretty,
Yeah.
stand, and then come back down into a bag.
Okay, okay.
Okay, so that's eccentrically using the hamstrings and the quads, right? And he can do like 60 to 80 in a row.
Wow, damn.
Yeah, I'm telling you, man, he's
muscular.
strong. He's one of very few dogs in the world that can walk on a round ball and go forward, backwards, sideways, spin, and twirl on top with no support.
That is so cool.
Yeah, so he's amazing. But he couldn't even do sit up and bag because the scar tissue was pulling him down. And I used the tuning fork with the amethyst tip, and that's what's good for fascia. And it wasn't cutting it. And I'm like, what can I do? What can I do? And I remembered lapis. Lapis is for scar tissue. And I pulled out a lapis tip, and literally within 5 or 6 minutes, all of the scar tissue was gone, and he was fully able to extend. And I'm like, oh my God, this is amazing. I have to try this on other things and see what I can do, and then teach people so that they can do it and see the same kind of results, because it's amazing.
Why aren't more people doing this or talking about, like, how come, like, people, vets, doctors are not, why isn't this a popular modality, the tuning forks?
I'm trying. Right? So I learned about it. One of my heroes is Patrice Corticus. She's an osteopath from Finland, and she comes to the United States 4 or 5 times a year, and she puts on a seminar in Eugene, Oregon, and she has like 12 vets in each course. And she's the one who taught me about the tuning fork, but she doesn't use the tips.
Okay.
She just used the naked tuning fork. And I started, the way I learned about this, okay, this is another really cool story, is I had broken my fibula, and I'm a rehab vet, right? So I was doing everything to get this thing to fix. I was lasering it, using PEMF, using ozone, using CO2, acupuncture, chiropractic, joint mobs, physical therapy, everything. And my ankle was huge. And I was talking to my physical therapist, who I vetted very well, so a really smart guy. And I said, this is ridiculous. It's been 3 months. And he said, Laurie, calm down, right? Because I tend to be a lot. He's like, it'll take a year to a year and a half to go away. And I'm like, oh. And I went to Patrice's course, and she said, Laurie, I'll work on you, and we're going to clear your lymphatics, and in 72 hours, 80% of the swelling will be gone, and in 3 weeks, the rest of it will be gone.
Oh my
And
gosh.
she used the tuning fork to clear my lymphatics, and sure enough, 72 hours later, 80% of the swelling was gone, and within a couple weeks, the rest of it was gone. And I'm like, I'm in. I have to figure out all I can about this, and then share it with as many people as possible, because this is crazy. I was just at the American Veterinary Chiropractic Association, right? So it's 216 people, all veterinarians and chiropractors. And one of the guys came there, and he said he'd been doing chiropractic the longest. He was over 50 years, and his hands were just all crunched up, and he could barely move his hands. And in 5 minutes, I only did one hand. I'm like, you have to do the other one, because I'm working with other people. We had it totally flat, and he could grab something again.
Wow.
I'm like, people need to know about this.
So what is a tuning fork? Because I think that was the next thing on my notes anyways, is to segue into the tuning forks, because that was, I think, the biggest thing that you talked about at the Feed Real Summit, and I learned a lot about it. Is it the vibration, a certain frequency that's like breaking up the tightness of the fascia? Is that what's happening?
I would love to tell you we know, and there's no research. So I teach for VIN, which is the Veterinary Information Network, right? I've been part of their pain management course for the last 15 years. And I'm a research nerd. And if you don't know VIN, there's over 60,000 veterinarians in this, right? This is a big thing. And when I came to them and said, I want to teach on laser, they said, there's no research. And I'm like, here's 1,200 research articles. And they're like, okay, teach on laser. And then a couple years later, I said, I want to teach on PEMF. And they said, there's no research. And I'm like, here's 125 research articles on it. And they said, okay, you can teach on PEMF. And about 3 years ago, I came to them and I said, guys, I have found a tool that is absolutely amazing. And I have done an extensive lit search. There is zero research on this. And I thought they were going to be like, eh.
Yeah.
And they're like, Laurie, we trust you. And if you believe in it, not only do we want you to teach on it, we want to learn from you.
You brought us lots of other things before. Keep it coming.
Right. So there's not research on it. I would love to get my hands. Again, I was just at the American Veterinary Chiropractic Association at the chiropractic school talking to people about, will you do the research, right? I'm a practitioner, I'm a teacher, I'm not a researcher. So we need people, if anybody out there is listening, is like, I would do research on that. I would love to be part of that. And just be able to put the science behind what we're seeing.
So we're not too sure what's happening then.
Right. So we know that 128 is the frequency of fascia.
Okay.
So if I take a trigger point on SID and I activate the tuning fork and I use the amethyst tip for any soft tissue and I put it on the trigger point, literally within 20 to 30 seconds, the trigger point is gone. If I activate it and I put it on my hand and I'm hydrated, see how it slides and glides? There's a fascial restriction, like say on my neck. Can you see the grab? It doesn't slide glide. That's what we call sticky icky. There's a fascial restriction. So with the tip, it's a diagnostic tool as well as a therapeutic tool, because you can find where the fascial restrictions are and then just put it perpendicular and let it vibrate. Whatever it's doing with the fascia, it releases everything. And like I said, Patrice worked on my lymph ducts, my lymph nodes, and it gets everything moving. So, and again, fascia is around all the blood vessels. So when it gets sticky icky, it decreases blood flow to everything. It's around the lymphatics. So when it's sticky icky, your immune system doesn't work as well.
Yeah.
In fact, there's a study in mice that show that they injected a whole bunch of mice with tumor cells, and then half the mice they let do their own thing, and half of them they did these little stretching exercises to stretch their fascia. And the mice that had their fascia stretched had significantly less metastasis, right? So you're stretching the fascia, you're getting that fluid flowing so the immune system can do its thing to help the mice fight the tumor cells that they put into their body.
Whoa.
We can do just by activating it and listening to it. I don't know if I did that with you, but it turns on your parasympathetic nervous system. So your rest and digest, right? So that it just helps you be more calm and focused and relaxed and takes that stress, that fear, flight, fight, fawn, and freeze out of your system and lets your adrenals rest, which is much better for your health. Like I said, using the different tips, we get different effects. The lapis is amazing for scar tissue. At ABCA, the chiropractic meeting, I had a chiropractic student say, because I always say, what's going on with you? How can I help you? And her answer was, I've had ulcerative colitis for 12 weeks. And I'm like, okay. So we used citrine, and I spent 10 minutes citrine over her belly, right, over her stomach. And I said, anything that's sticky icky, just stop and let it do its thing. I did my 10 minutes. I had to go to somebody else. I'm like, take the fork, use it while you're standing here. The next day she came to me and said, Laurie, I have to tell you, I had pizza for dinner last night. It's the first time in 12 weeks I had a meal that I didn't look like I was 9 months pregnant afterwards. All of the inflammation was gone.
Wow.
Who would have thunk? Right? It's so crazy how cool this stuff is.
What are some of your favorite things to use a tuning fork on or for? Obviously fascia, but like is there like a maybe like repeated problem that you see a lot of dogs presenting with, and you're like tuning fork?
So, like, one of the things we teach in the course, and I teach my clients, is to use it going down their back, because that not only is working on the fascia in their back, but you also have a whole bunch of acupuncture points, right? And again, it'll tell you where it needs to stop, because it'll slide and then all of a sudden it's sticky icky. And you know there's fascial restrictions. You can use the tuning fork to treat acupuncture points. So you can laugh at me. I've done heart surgery. I've taken out tumors this big, and I'm needle phobic. So like I can't watch needles go into my skin. So when I go to the acupuncturist, she treats me, but then she takes a Sharpie and puts dots on me, and then I can go home and use a tuning fork and stimulate those points without having to put needles in myself.
Oh, wow. Okay.
So trigger points, bladder or acupuncture points. We can release the diaphragm so they can breathe easier, which is great for athletes. We can, anytime I do chiropractic therapy now, I go up the spine, and that fixes like 2/3 of what I have to fix. So my treatment is much faster. There's just so many things.
That's so cool. When one of the things, and I don't know what, now that we're talking about tuning forks and what I'm about to say about one of the times when I was at your booth, I don't know how they aligned. So I'm going to tell you my story because it was very interesting. There was a whole bunch of us around your booth, and you were talking about, I think, energetics, and you made like a ball of energy.
A Tai Chi ball, yes.
Okay. Why were we talking about that? What is, does that have anything to do, how does that play into the body?
So you can affect the biofield. Again, there's the science half of me and the energy woo-woo half of me.
Let's go there for a little while.
Excuse me, yes. So the stones can talk to you. And you can be like, yeah, Laurie, stones can talk to you. Ha, 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 right? And I have not had a single person yet who, when we take the tuning forks and we say, okay, you bought the course, the forks are exactly the same. The only thing different is the tip. And everybody who gets a course, the tuning into your dog, gets a free 128 hertz tuning fork with an amethyst tip. And the reason I do that is because I never want anybody to get a cheap, not high quality one and say what Laurie taught me didn't work, right? So we just package it all together. You get the course, you get a good instrument. And forks are exactly the same. The only thing difference is the stone. They're all amethyst. And I have people take their left hand, because your left hand is your receiving hand. So that's where you get the most information from. Your right hand is your giving hand if you're giving energy. And ask the question, which is the best tuning fork or tip, amethyst tip for me? And one of them will call to them. So it'll be the same thing that you feel when you put your hand between my hands in the Tai Chi ball. So for some people it's hot, some people it's cold, some people it's pressure, some people it feels like a magnet, some people it feels tingly. Whatever you feel is what you're going to feel over one of those stones. So learning how to ask the right questions, and then, so like I have all of my tuning forks out when I work, and I say, who wants to play with me to treat Sid? And then where do I need to put it? Okay, so to give you an idea, this is how cool this is. I was at AVCA, and there was a chiropractor there, and I said, okay, she's like, I don't know, I got all kinds of things going on. I'm like, okay, let me ask the stones. And I said, who wants to play? And my lapis came up, and I'm like, okay, where do you want to go, lapis? And I'm like, that's really weird. It wants to come right here on you. And she said, oh, that makes total sense. I'm like, it's for scar tissue, and I don't know why. She said, when I was 17, she's 40. When I was 17, I had my salivary glands removed on that side.
Whoa.
Wow, right? So that's the first wow. So this is the kind of validation I get. And so we do this again, 3-4 minutes maybe. And I'm like, okay, he says he's done. She's like, oh my God, I haven't been able to move my tongue that much since I was 17.
Whoa.
Yep. And I'm like, wow, that's cool. My brother-in-law has Duodemitrans, which is where you have scar tissue in your tendons.
Okay.
He'd been to 6 months of physical therapy. They were talking about he plays guitar, right? And his hand his two fingers were literally curled, and they are talking about either doing surgery and scraping them or injecting collagenase, which is an enzyme that breaks up collagen. Well, your tendons are made of collagen too,
Yeah, you need that.
right? Right? I was there, it was Christmas last year, and with the tuning fork, for 4 days I was there, he kept doing it and doing it and doing it, and so a lot. He has full extension of his hand.
Wow.
Full extension of his hand. And I saw him in July, and he still had full extension of his hand.
Without doing like repeated treatment
Right.
or anything like that.
Right.
Wow.
Of course, I gave him a tuning fork. I'm like, if it ever comes back, you have it. He's like, I had to.
Wow. That's nuts.
Yeah.
So I want to go back to the woo woo for a little while because that
Okay.
the woo woo fascinates me. And the thing that was really cool. So we're sitting at your booth. You make your ball. You asked me to stick my hand in it. I felt warmth. So that was the way that I felt energy there. And then some other people were there, and you asked me to be a guinea pig. You had me turn around so everyone was behind me, and you had everyone like run their hand along my back without me feeling it. Like they weren't on my back. They were, I don't know, probably like 4 or 6 inches away from my back. And the more that you did it, eventually I was like, Dr. Laurie, is everyone, because you were trying to find like my center of, not gravity, like my energetic center, I guess, right? I was like, Dr. Laurie, is everyone pointing right here? Because I could feel all the heat rising right there, like right in between my shoulder blades. And you're like, yeah, that's where everyone is finding your energetic field. And I was like, okay. And it was so strong that I felt it for another like 15, 20 minutes after that. And I even like told the girls that I was with, I was like, put your hand right here on my back. And they actually put it there, and they're like, you're really hot. And I'm like, and like my hair was down and everything. Like it's not like they were touching my back. It was just so crazy that I was able to feel it and not even know what I was supposed to be feeling or where I was supposed to be feeling it. So what was that? That was my energetic center?
So that was where you were stuck, right?
Oh, okay.
So you have a biofield. Okay, so you're really asking me to go into the woo-woo, right?
Let's do it.
Okay, so you have a biofield, and you can work with the biofield, and you can have issues. So I can literally, with Sid, take my hand down him and say, do you have a problem? And if he's sore here or he has a problem, I will feel a change, which is what, if you did that to somebody else, you would feel a change. And again, it may be hot, it may be cold, it may be magnetic, but you feel a change. And then if you were to palpate, you'd be like, oh yeah, he has a trigger point there. Or actually, that's really funny because I put my hand on him. I don't know if you saw it. He just spasmed. I'm like,
Like a punch, yeah.
I need to treat my dog later. And what you felt was everybody's energy, right? Feeling your energy. So there was a mix of the energy, and everybody kept stopping, right? So every time they stop, they're putting their energy into you as they're feeling your energy. So there was an exchange there. So you can heal with energy, right? You can receive information about the energetic field. There's all right, take you one step further.
Please do.
With the tuning fork, right? There's what's it called? I think it's biofield something course on learning how to work with the biofield with the tuning forks, and which is one of the things I'm learning, so I can teach it for dogs because it's for people. And you can activate the tuning fork and then come into their field, and if the tuning fork wants to touch him, there's no resistance, right? So this is amethyst, so it definitely wants to touch him, so it goes right to him. If I were to take, who wants to play? Citrine. Okay. So if I take citrine, which is yellow, and I do it, I get to right there, and there's resistance. Right? So in his field, there's something going on there, and it's crazy because you're like, now could I push past it? Absolutely. But does it want to? No.
Right.
And it is very easy to feel. And you can work in that area in the field. You can't really see what I'm doing. But you can work in that area in the field and fix it. And then it'll be like, okay, I'm done. Right? Can I tell you what we're fixing? Not a clue.
Not yet.
Not yet. Not yet. But I am learning. Every day I'm learning.
That's so cool. Yeah, for me that was like, it literally felt like a heating pad on my back.
Wow.
Like it was significant. It wasn't small. Like it was not intense. Like I wasn't in pain by any means, but
Right.
I was like, There is something to that because that was wild. It was
Yeah.
probably one of my favorite moments of the Federal
Oh,
Summit this year.
cool.
So yes, that's amazing. So okay, trying to get back to my notes because that was just so amazing that I'm like flabbergasted. And I just lost all my bearings on this. Okay, what kind of conditions tend to respond well to the tuning forks? But I mean, all of the above, right? Arthritic dogs, sports dogs, injury dogs. Do you find that you have like I guess, okay, let me ask this from a behavioral standpoint because I'm,
Mhm.
a behaviorist. Have you worked tuning forks or I guess any of your modalities really, and then also saw a change in behavior?
Yes. A deer, oh my God, they've been my clients for 5 or 6 years. And I worked on first one of their dogs, and Lance passed away at 18. And
Wow.
recently they brought me Jewel, and then like this is within the last couple months. And Jewel was in a hoarding situation. So they adopted both Lancelot and Jewel together. And there were things that no dog, no human should be around. I'll just say it that way. I don't want to depress anybody.
Yeah.
Just a lot, right? Um, and they could, their ability to touch her was 3 to 4 seconds, right? She didn't want to be touched. She was pacing. The best way to describe it is she was uncomfortable in her own skin. And they said, okay, Lori, you know what? She's 16. If there's anything you can do to help her, please do. Right. So we did our exam, and I'm like, I just feel like there's a lot going on. Right. It's not just her body. I mean, she has arthritis in her hips and her knees, but she's strong-ish for a 16-year-old because she's pacing constantly. And I said, okay, we're going to use soda light and we're going to put it on her heart chakra. Because soda light, let me show you what that one looks like. If you can see, there you
She's so
go.
pretty. Yeah.
It pulls out grief, sorrow, PTSD, fear. And then we use rose quartz, which
For
is
some love,
pink.
self-love, right?
Yep. And during the evaluation, I was working with her in her energy fields, and she literally fell asleep. And I rolled her over, and they're like, oh my God, we have never been able to touch her when she's asleep without her jumping up and running. I'm like, look, I'm rubbing her belly. She's cool with this. By the third time I worked on her, we used the sodalite and then the rose quartz over her heart. And the next time they came in, they said, Dr. Lori, we were able to love on her for 6 to 7 minutes last night, right? And the last time I worked on her, she came in, she laid down, I put my hands on her, she went to sleep. We did acupuncture, we did manual therapy, we did everything. She never woke up. We
Wow.
got done, she got up, she shook, she walked around, she was happy. I mean, it gave this pup, even though she's 16, a whole new lease on life.
Yeah, yeah, that's amazing. It's, I think us as people, we just move so fast through this world that we forget how much, how big an impact of just focusing on your breath
Oh yeah,
and
huge.
calming your energy and just like, things don't have to be so complicated as doing this whole grand like training thing. Like sometimes it's just as simple as we got to heal what's on the inside. And there's a lot of different ways I think that that can be done. I guess kind of a small funny story now that I'm trying to implement that more into my training, especially because I deal with a lot of anxious dogs, right? We were over at my parents' house a couple weekends ago making tamales for the Christmas season. And for some reason, my parents also have two schnauzers. We're a huge schnauzer family.
Uh-huh.
But for whatever reason, one of my parents' dogs just got like, he was hiding in the bathroom. He wasn't coming out. If he did come out, he was like really slinky and he was shaking. And our Augie is not the most confident dog. Like he definitely is like sometimes the ice maker will like make him run and hide, but for whatever
Oh,
reason he was just like having a moment. And there was, a good handful of people in the house, but it was the family people he's very familiar with. My parents are huge like social people. They always have guests over, and he was never like that. Even when, unfamiliar people are over. So I was like, okay, well, I'm gonna go, hang out with Augie. So I put him on my lap and I kind of like pressed him up against me, and I just breathed. And I just took deep breaths in and deep breaths out. And within like a minute, his whole body just like relaxed and he stopped shaking. And then he was able to walk around with everyone for a little bit. And then it kind of cycled back into everything. Like he kind of like got himself back up into a tizzy again. But I think it's so powerful when you think about something short, small, as just breathing with your dog and trusting that you can be in tune to find things. If you just kind of focus on your hand and what that energy shift may be, all the different things that you can do with that.
Can I share some science behind it with you? And have fun with you?
Yes.
All right. So are you in a place where you can stand up and reach down and touch your toes?
Okay, let's do it. I'm going to make some noise as I get up.
Okay. All right. All right.
Standing?
So standing up. Yep. So
I think you have pants on, Dr. Laurie.
do me a favor, turn sideways.
Turn sideways.
Yep. So people can see how far you reach.
Okay.
And then keep your knees straight and
Knees
go
straight.
down and touch your toes or as far as you can go.
Okay, I'm pretty flexible, okay?
Okay. Yep. Good. Now take a big inhale in. Big exhale out, long exhale. And then reach further. Go down further.
I
Yep.
got my whole hand down.
Yes. You went down probably a good 5-10 degrees at least.
That's crazy. All for
Isn't that
breath.
cool? So what's happening when you do a big exhale, or if you hum, kind of like vibration, right? You stimulate the vagus nerve, which is the only nerve from the brain that comes all the way down. It comes to your pelvis, and it has all these little receptors on it, and that receptors take that information, goes up to your brain, and releases serotonin and some other chemicals into your brain that makes your body relax. And what's really cool is not only can you doing a deep breath that if you're stretching your dog, they stretch further with you doing the exhale.
That's wild.
Yes.
Yeah.
And with humming, you were just doing the deep breathing. If you were to hum that deep vibration in your chest, that there's research that shows that even humming stimulates that vagus nerve. And for years, I didn't know this research, but when I had a stressed dog, I would put my hands on them and I would watch them soften.
I mean, and some of this is like, we still practice some of these things today, which is why you hum and like pat a baby when you're trying to get them to sleep. So, I mean, it's just funny how people will do things like not thinking about how quote unquote woo that is, and then refuse to extrapolate that to other things because, yeah, it works. You just gotta be open-minded to it.
Yeah, well, think about just rocking a baby, right? Or swaying with a baby. What are you doing? Vibration, right? You're vibrating at a slow pace their whole lymphatic system by doing that.
That's so interesting. Their lymphatic system, you said?
Well, it's their whole nervous system, their lymphatic system, yeah.
Wow,
So
okay.
same thing when you think lymphatics. Have you ever jumped on a rebounder?
Yeah.
Right? Your lymph system only goes in one direction. There's unidirectional valves.
I don't.
So if you jump on a rebounder, it's pushing your lymph up, right? Because your lymph dumps into your subclavian veins at your chest.
Okay.
And that rebounding helps your immune system and helps you feel better, helps your circulation because you're getting all of that to dump out in here. And even doing a deep breath where you're, when you do that, excuse me, that opens up your thoracic and terminal duct. That's another way for your lymphatics to dump. So that negative pressure between your lungs and your chest pulls the sticky, icky stuff out of those lymph vessels into your blood system that then goes into your liver that can be detoxified.
I can't wait until the term sticky icky is a true scientific pointer. When we do all the research and then it's actually going to be the true scientific term is sticky icky.
Yes. Well, I mean, isn't it, I coined the term, but to me, it just explains everything.
It really does. You know exactly what you're talking about. And especially if, for any of you guys who aren't watching Dr. Lori use the tuning fork and how it slides, it really does like grip and it like doesn't move. And I'm sure some of you guys are like, yeah, well, she just like, stopped moving it. Like, it's different when you see it in person because you did it on my hand and it got sticky icky, right? And you're like, oh, you're a bit dehydrated. And the more that you did it, the more that it started to glide, and the more that I was like, yeah, I need to go drink some more water. So that was super cool. We talked a lot about different things, breathing with your dog, kind of finding your energy field. Something I think that's kind of easy for people to do at home if they wanted to kind of explore that. Are tuning forks something that people can also learn to do as a modality at home?
Absolutely. In fact, when I created the Tuning into Your Dog course, it's for both professionals as well as pet parents. And I didn't get it race approved because my clients were like, if I see something is only for vets, I'm not going to take it. And I want everybody to be able to use it. So it's my only course that's not race approved for professionals. And the reason I did it is so that everybody can learn it and just have amazing results with it.
What kind of things do you think, and they could be like rapid fire suggestions, but like what sort of like issues would you say, like, yeah, if your dog has that, this would be a great course for you?
Any geriatric dog, any adult dog, any dog with any swelling, and that could be something like allergies, right? Because that's going to get their lymph system going. Any kind of GI upset, any kind of metabolic disease, right? Because you can use it to stimulate the acupuncture points. You can use it for back pain. You can use it for any trigger points. If you're an athlete, you're going to be able to use it for better motion because you're getting rid of all the trigger points. We teach you how to find trigger points in there. So you know what to look for and then how to fix it.
What about like itchy skin? Because I would think that can also just be like an immune thing, an immune system thing. So if we're also kind of activating the lymphatic system, perhaps we could see some benefits for skin as well.
Maybe. I haven't personally used it, right? I'll always be
Okay.
100% transparent and
Yeah.
honest. I haven't specifically used it for that. Can I tell you it will help with inflammation? Absolutely. Can I tell you it will help with the immune system? Absolutely.
Gotcha.
So there's definitely a possibility.
Yeah, that's so cool. Tell us a little bit more about the course. Like if someone was listening and they're interested in it, it's something that they can get from your website,
Yep.
Optimum Pet Vitality.
Yes.
Is it a self-paced course? Is it just a long video? Tell us a little bit about like the structure of it.
So I am a nerd, not just in science, but I love to learn how people learn, and when I went through school, they structured things so that classes would be 50 minutes because that's what our brains could handle before we lost focus. Nowadays, our attention span is much shorter. So
Thanks to
all of
social
the
media.
lectures, yeah, right. All of the lectures are between like 5 and 15 to 20 minutes
Oh wow.
tops.
Okay.
So there's 17 modules. It's only a few hours long, but it's broken down. It's easy to listen to. It's here's why, here's how, here's on a dog. So there's, you can do it in little bits. You have it for a year. And then if you want to continue, it's like minimally, there's a minimal charge to keep it year after year after year so that you have it that you can go back to for new problems, new pets, all of that stuff. It's self-paced. You can listen to it again and again. There's a, I don't know what else to tell you.
I think that's pretty good.
Yeah.
Okay, cool. Maybe can you share with us one of your favorite case studies or case stories, a client that you had some really great noticeable effects with?
Well, I told you about Jewel. I can tell you about, I can tell you about Fluffy.
Okay.
Fluffy is an agility dog who repeatedly would have issues with the gracilis muscle, so the inside of the thigh. It's very common in athletes. And mom literally had bought an $18,000 laser because I would only see the dog like every 6 to 8 weeks. and she was doing the treatments in between, and not everybody can do that. And she was having trouble keeping these trigger points away. And we're like, okay, let's use the amethyst, right? Just the regular old amethyst for soft tissue. And she doesn't have problems anymore.
Wow.
She can do it every couple days. It takes 30 to 60 seconds on each leg, and the trigger points are gone. And that allows Fluffy to run as fast on Sunday as she does on Friday.
That's awesome. So, something so simple, but so profound, has great effects, and something that you can do at home.
Yeah,
I love
yeah.
Very good. Well, Dr. Laurie, thank you so much for all your information. I have all my notes, things I'm going to be doing with Sully. I've also learned so much myself, so thank you for all of that. How can listeners get to know you a little bit more, or possibly follow you on social media, websites? Where are the
Yes.
places?
So if you look up Optimum Pet Vitality, we are on Facebook, Instagram, LinkedIn. We have over 100 videos on YouTube that people can learn stuff from. They can go to our website, optimumpetvitality.com, and see what we offer there, class-wise, course-wise. We have a whole set of courses for professionals and another whole set for pet parents, so they can go through there. We have the at-home laser course, we have the fascia course, we have Core and More, the exercise course, and then we have tuning into your dog. In fact, for your listeners, we created a coupon code called PUP, that if they use PUP, they get 10% off the tuning into your dog course.
That's
And as long as-
amazing.
yeah, and as long as they're in the US, because the last time I sent a tuning fork to Canada, it was $50.
Oh, no.
Holy cow. Okay, can't do that anymore. As long as you have a US address, and some of my Canadian followers will literally have either a friend or somebody in the US or a mailbox in the US that we can mail it to.
Nice.
So they get a tuning fork with the amethyst tip.
Awesome. So go to optimumpetvitality.com, look for courses. You're going to find the Tuning Forks course. Is that what it's called, Tuning Forks?
It's tuning into your dog.
Tuning into your dog, and then in the promo code put in PUP, P-U-P, and that'll get you guys 10% off. Thank you so
Yeah.
much, Dr. Laurie. I cannot wait. I look forward to also taking that at some point. I'm in the middle of Dr. Ruth's holistic pet health care coach program, so
Yeah.
my brain is a bit full at the moment, but the Tuning Forks is definitely something that I felt compelled to list, something was just drawing me to your booth, and then again feeling the heat on my back, and again just knowing something that's simple yet has a lot of really great effects, and something that anyone can do at home. That's always something that I'm looking for. The more things that we can do at home, the more support that we can give our babies. Of course there's a little bit of investment in getting those things in the very beginning, but they pay off in the long run, especially if you have multiple pets. Super, super easy.
Well, and beyond that, it's not only like at your home, but my tuning forks go with me in my purse, right?
Yeah.
So if you travel, they can go on an airplane, right? So it's relatively inexpensive, and you can take it anywhere.
Yeah, use it for yourself, use it for the dogs. That's always
Yep.
one of my things. Like I got Sully a red light little panel, and I was like, I can use this for myself too. So it benefits
Yeah.
everybody. I
Yep.
love that.
Absolutely.
Dr. Laurie, is there anything else that you want the listeners to know about you before we let you go?
Oh, there's so much, right? But so much I could teach, right? So we could do whole podcasts on laser and exercise and stretching and all kinds of stuff, but another day.
I'm going to put you down for that. Don't you worry.
Okay, awesome.
All right, listeners, thank you guys so much for tuning in with me and Dr. Laurie today. We appreciate you guys, and we hope to catch y'all on the next episode. I will be dropping all of those links in the show notes for you guys. So we will see y'all next time. Bye.
Thanks for having me.
Now, that might be the end of the episode, but the fun doesn't have to stop here. Follow us on social media. I'd love to connect with you. We have quite a few social media platforms. For nutrition and holistic pet care tips, follow me on TikTok and Instagram at Steph the Pro Dog Mom. You can find fun training tips on Facebook, TikTok, and Instagram at Pup and Away SA. If you're in San Antonio and you want to bring your dog to us for boarding, training, socialization, and nutrition, come find us. But if you're not in San Antonio, we do training and nutrition sessions virtually. Yes, they can be just as effective, I promise. Please rate, review, and subscribe to my podcast on whatever platform you listen on. And please, please, please share with a friend. The positive reinforcement of knowing people actually listen to this and find it valuable helps motivate me to keep on recording. We'll see you guys at the next episode.